Today's episode, I think, is really fascinating. It's all about the intersection of cannabis and oral health with the talented educator, Stacy Bobak, who is a registered dental hygienist and a certified educator in Ontario, Canada. She's the creator and owner of CannaDent, a cannabis education platform for dental professionals, and works as a college professor, public speaker, and non-profit founder. She's a breast cancer survivor and a medical cannabis patient advocate and a soon-to-be first-time mom. Woo woo! This is the second pregnant woman on the podcast, which is so exciting. And just an update on Liz Peterson from the THCA episode, who is also pregnant while recording. She has had her beautiful baby just a few weeks ago, and both are doing fantastic. I want to give a quick shout out to one of the sponsors and supporters of this podcast called Flower Mill, which it's not a grinder, it's a mill. And it's seriously the best smoking accessory you can buy. I've had mine for about a year and a half, and I'll never go back to a traditional grinder. I'm going to be giving one of these away on Instagram because they are quite expensive in the next few weeks. So stay tuned for that post and make sure you're following the Bioactive Instagram account. If you want to ask guests like Stacy questions ahead of time, send me direct messages, or stay up to date with my plants at home, join the Bioactive Patreon for as little as $1 a month. Or if you want a free way to support this podcast, slam that 5-star review button on Apple or Spotify. It seriously helps. Take a deep breath, relax your jaw, take a sip of water, and chill with Stacy and I for the next hour. Awesome. Well, welcome back to the Bioactive podcast. I'm really excited to learn from the guest I have on today and the topic because I know essentially nothing about this. We have Stacy Bobak, who is working as a cannabis dentistry educator. I think that might be kind of the way to describe it. But as we were just talking about before we pressed record here, there's so many different consumption methods that involve your mouth. Your mouth is directly involved in cannabis and cannabinoid medicine, but you can also use some medicines to directly apply it to your mouth, which is an area I haven't really thought about at all. But of course, other natural products are used all the time in our mouth. So I'm really excited to learn about this. Thank you so much for coming on, Stacy. And if you wouldn't mind just giving a little more background about what you do and how you got involved in this specific field of work.
Yeah, it's really my pleasure. Thank you, Riley, for having me on. I'm Stacy Bobak. I'm a registered dental hygienist and I'm a certified cannabis educator. And I like to say I'm addicted to learning about cannabis. I could read cannabis research, especially as it relates to dentistry, all day long. My passion is really to share the evidence-based information and facts about cannabis with the public. So I've been in practice as a dental hygienist since 2007, but like you said, I also teach in the dental college space. And I decided to go back to school. I thought I'd be a hygienist forever, but I went back to school to learn about cannabis after a breast cancer diagnosis in 2018. I'd had knowledge of consuming cannabis socially, but I had no idea there was more to the story. And having a healthcare background, I wanted to know more about this plant before I kind of came out of the cannabis closet, call it, as a medical patient. From
Love
that
that.
course, yeah, right. Of course, I fell in love with the science, really got an opportunity then to combine these two passions. I love oral health and preventing disease with your overall health, and now this newfound love of cannabis science. So I created an educational platform basically for dental professionals to help them continue the conversation with their clients, with each other about how cannabis relates to dentistry. I also got a chance to create and review some college level cannabis content and teach in the college about both dentistry and cannabis. So I wear a couple hats. I teach in a cannabis cultivation and processing program. I teach in the
Ooh.
dental program. And then within the dental program, I go in and do guest speaking. I work for a company that provides continuing education to dental professionals. So I've got to go out into conferences now. And this newfound knowledge has really given me my voice. And now I own that knowledge that I got to learn. And I'm so passionate to now be able to share it with others in my spare time. Not that there's a lot of it between the teaching, but started a nonprofit for other certified cannabis educators like myself back in 2020 called Education. So we have a board of 9 women. We have members across Canada and the US, and we help get access to this cannabis education. And I also work with another breast cancer survivor. We have a podcast we did one season of called The Tincture of Time, just getting the education
Cool.
out there to cancer patients. And I get to work with my local cannabis lounge. Really, when I took this course and federal legalization happened in Canada, I'm up in Ontario, my question was, we see a lot about the harms and the risks with recreational use coming available, but how are people going to get knowledge to the therapeutic and medical benefits of cannabis? And at that time, the answer was, we don't know. So I really made it my mission to try to get that therapeutic message out to the public.
Oh my gosh, I literally had chills like multiple times when you were talking about that because, you talked about it being like addicting, learning about cannabis and how it works in the body. And I totally agree. I think I love seeing that spark in people's eyes when they learn about the endocannabinoid system and how it works in our body and how it controls all of these other things and the just immense therapeutic potential of this plant. And it really does get addicting to start to look into that science and be like, wow, there is actually so much science here. We just don't really have a way of communicating it to other scientific professionals or medical professionals or even to the general public. And just seeing you directly see that issue and fill that gap in your local community and even online as well, it's just really empowering. And I hope that's inspiring to a lot of people because that's really where we're missing so much information is like, disseminating the studies and getting other people involved and focusing on the therapeutic aspects. So people know that like, chain smoking blunts is fun, but like there's also a ton of medical value of this plant, and especially the different ways that we can use it, such as, in our mouths or on our skin or suppositories. Like it's really, there's a lot of diverse ways to consume the plant based on your current situation. And if you want to feel high and if you don't want to feel high, etc. So accolades to you for that. And, congratulations on starting everything that you have. Would you mind kind of diving in a little more before we get too into like the actual products that are available and all that kind of stuff? Just why oral health is important and like what is the link between oral health and our general health, and what should we be focusing on with our oral health?
Yeah, totally. I'm happy to do that. So, in general, we have problems that can arise in the mouth and they can affect the rest of the body, and even vice versa. Some diseases in the body can affect your oral health. So, not unlike other parts of the body, our mouth is full of germs. Usually, those germs are harmless, but we're constantly fighting off this potential infection. So sometimes those germs can spread to other parts of the body, like the digestive tract. Think about how your mouth is very directly related to the digestive tract. Also, the respiratory tract, you're breathing in the air through your nose and mouth. The cardiovascular system, if there's any bleeding when you floss or brush or go to the dentist, those bacteria then spread out. And we're starting to see links between inflammation of the gums and things like pneumonia, premature birth and low birth weight, type 2 diabetes, endocarditis, Alzheimer's disease, even clogged arteries and stroke. So, definitely by taking care of your teeth, you're investing in your overall health. And the reason I wanted to combine this knowledge is that there just isn't a lot of education around where does cannabis come into play when we're talking about dentistry and oral health.
Wow, that's really cool. And of course, there's links as you're describing. I actually didn't even think about like the gums bleeding and heart health as being linked in that way. But even just like the level that you are taking care of yourself in general probably has parallels to your oral health and how much you're taking care of your mouth, you know, as far as like healthy body and healthy mouth and how much time you dedicate to that. Um, so there's also the when you're smoking cannabis or you're vaping cannabis, a lot of people get cotton mouth, which is essentially like you have decreased saliva production in your mouth, which makes it really dry and it makes you really thirsty. I think a lot of the listeners are probably familiar with that. Is there a link between having less saliva or like less hydration in your mouth and that being linked to anything oral health related?
Totally. Just thinking about the role that saliva has in general, it does a few very important things. So it helps to prevent cavities because it has some antibacterial properties. When we eat something acidic, it can help bring the pH back into balance. And the start of a cavity is demineralization of the enamel. So the saliva then can remineralize or strengthen up the hard part of your tooth so that you don't get a cavity. If you don't have the saliva, then you're more likely to get a cavity. Digestion, it's a buffer. It's washing away the food from your teeth, and it's also helping you swallow. It literally lines the mucous membrane to prevent oral infection. So, with this acute side effect, is really the number one side effect of any cannabis consumption of dry mouth, or called xerostomia. We get still some effects, even though it is short lived. But the majority of effects come from this chronic, continued dry mouth. So the effects could range from bad breath to up to as worse as a fungal infection. So, what you can do to prevent the cotton mouth or prevent the pasties are just keep sipping water throughout the day. You want to give your mouth that additional moisture to try to help to prevent those side effects of dry mouth. You can use like a water bottle to spray water in there, or maybe even an alcohol-free mouthwash. I really like mouthwashes that have aloe or glycerin because they make
Ooh.
the benefits last a little longer. You can trick your brain into creating more saliva naturally by having a sugarless candy, lozenge, or
Mm.
gum. I like trying something with xylitol because it actually helps to promote good bacteria, but you want to keep xylitol products away from your pets, just as a fun fact.
I just learned
Um,
about that from like TikTok. One of the this sounds so dumb, but I'm gonna say it anyway. One of the the guy who like runs Barstool Sports, he got a dog named Miss Peaches, and she got into a bunch of xylitol containing gum and had
oh
to be like
no.
rushed to the vet, and it was like this whole thing. And that's how I learned that xylitol gum was bad for dogs. But yeah, and how do you feel about products like Flint's mints? I think they have the active ingredient from the plant splanthus in them, and it makes you like salivate more. I don't know if you've ever tried them.
I am not familiar, but if it's triggering your natural saliva production, I would say it's a good thing. Like there are similar products, I think, around here that help to promote promote saliva, I should say, whether it's a spray or a mint, something you're putting in your cheek at night kind of thing. Like
Hmm.
there's lots of people that have chronic diseases outside of cannabis that cause dry mouth. So we have lots of products. I think it's worth trying. It's better than suffering from the dry mouth for sure. So, saliva substitutes in general, I'm great with. Maybe you want to talk to a pharmacist or your dental professional about the best ones for you that they might have tried.
Awesome. Let's get into some consumption methods and how that might affect our mouth. So I think definitely smoking and vaping we have to talk about. And actually something that you got me really thinking about is if you did have mouth sores or something inflammatory in your mouth and you're smoking, could you just kind of like hold the smoke and move it around your mouth? Or is that just like not effectively moving the cannabinoids? Is that just like moving the particulates in the smoke? Or would you just recommend other methods if we got something going on in our mouth other than trying to swish smoke?
Yeah, when it comes to medical cannabis in general, we know that not that I'm against smoking or, dry or vaporizing at all. I really feel that they have their place, but we tend to recommend other products because they're more direct in addressing something in the mouth. When you're holding a product in the mouth or you're putting a strip on the gums, it's going to have that longer duration of effect. Whereas smoking might not get through the mucous membrane as well. It's designed to go in through the lungs, right? The other thing, as traditional dental professionals, we're trained to advise against smoking anything because constant heat in the mouth can change the lining of your tissues, and it could lead to issues. Um, Chronic smoking of cannabis can cause dry mouth, and we just went over all the side effects of those. So knowing that we have these other modalities to consume, um, especially if you're treating and consuming with the intention of treating a condition in the mouth, like a symptom or a side effect, then I would
Absolutely.
say
Yeah, if you had
let's
like sores in your
investigate.
mouth, yeah, it probably wouldn't even feel good to smoke. Like even if you were administrating some of those active compounds, like there's so many less abrasive ways to put those
And I don't know if you've
medicines
ever
there.
had a, yeah, I don't know if you've ever had a tooth pulled, but they actually tell you not to smoke because you don't want to disrupt that blood clot. So, unfortunately, people who usually smoke for medicinal purposes can't after something like a dental extraction. So then they're coming to these other products. Yeah, for sure. So there's
Yeah.
definitely lots of options. And there's lots of science behind these other options as well. So now that we understand the role of the endocannabinoid system and we're starting to investigate where those receptors live when it comes to parts of the mouth, then we see science coming up with these new infused products to try to target those receptors to help those areas of the mouth.
Can
So
we
just
talk
in
about where they
general,
are? Yeah, I just need,
yeah,
I
yeah,
don't know
yeah.
anything about this. I want to know about where the ECS is in our mouths. And this is so important for anybody who does want to use this medicine because is it not the same everywhere? Is it like different in some places? I can't wait. Yeah, please dive into
Yeah,
that.
totally, totally. Okay, so generally we're doing some studies on like human cadavers to find out where the cannabinoid receptors are. And we're looking at live humans that have dental disease. So gingivitis, inflammation of the gums. And then the next step up, where it's a little bit worse, periodontitis, inflammation of the tissues around the teeth, into the bone, into the connective tissue. And we're watching the activation of the receptors in those areas and what kind of endocannabinoids are in those areas. What kind of endocannabinoids are there when it's healthy? What kind of endocannabinoids are there when it's inflamed or infected? So we have lots of endocannabinoids obviously floating around in our cells. All the two common ones, obviously, 2-AG and anandamide, but we also look at PEA, arachidonic acid, and OEA, and they're all present in the mouth, usually in saliva glands, interestingly. We do see this role where endocannabinoid plays a role in this inflammation process, so periodontal disease. And when we look at these different areas of the mouth, we see CB1, CB2, and GPR55 receptors in the tongue, in the lips, in the gingival tissue, so in your gums, and in the palate on the roof of the mouth. And again, different layers of skin have different amounts of CB1 and CB2 receptors. What we're coming from here is we know that those CB2 receptors are in the immune cells, right? They have that immune modulating function. So then we can dive into, okay, we know that there may be some immune cells here in the mouth, and what role do they play in disease? Now we can dive into those endocannabinoid receptors, and now we can target those endocannabinoid receptors to potentially help the healing process from these inflammatory based diseases, knowing what we know about both endocannabinoids and phytocannabinoids.
Wow, that is absolutely intriguing. And very cool thinking about the different product types available on the market and not even focusing on like the dental specific ones, but just all of them because I don't know if you've seen, but they now make these kind of little, they look like those Zyn packets, those tobacco ones that you can put between your lip and your gums. Um, you'd kind of think that would work as a targeted method if you had something going on in there because it would stay in one spot and kind of administer those active compounds slowly into those areas that do have these cannabinoid receptors. So that is really, really interesting. So using that information about where these receptors are in our body, then people like you and your colleagues are making products to target that. What kind of products are currently available for people if they did want to target something in their mouth?
Yeah, I'm not making products, but I'm all for promoting them
You
for
could
sure.
someday, though.
Yes, I would love to. And because we know, like you said, in general, herbs and including cannabis have been used for many, many years in traditional medicine for tooth pain, for decay or cavities, to help decrease inflammation. And they're all working by improving that quality of life. So let's still have that as an option for
Hmm.
people who want that alternative. So what we're doing, again, we're looking at these different cannabinoids, we're understanding their properties, and we're putting them into products. So products like capsules and pills we're familiar with already. You can hold them in your mouth. We have, of course, CBD hemp oil tinctures and CBD oil. You can hold that in your mouth as well, and it's going to transfer right through that mucous membrane, get into the blood-brain barrier, and have that effect.
Ooh,
We
an oil
have
pull with a CBD oil would be kind of rad. I kind of want to try that.
homemade coconut oil pull is a game changer, not only for oral effects, but I've had people tell me that it helps them with their respiratory issues as well.
Interesting.
Very
I am
interesting.
like 100% making that this weekend and definitely going to
Yes.
try it. You've tried it and have you liked it?
Yeah, there's benefits to coconut oil pulling in general, so why not add in some CBD to help with direct anti-inflammatory properties or analgesic?
Is that what the benefits of oil pulling are? I honestly don't know too much about the background, but a lot of the health forward people that I follow on the internet are very into oil pulling. I just never got into it, but if cannabis was involved, I would definitely get into it.
Yeah, to each their own for sure. Some people say it helps them with staining, with inflammation of the gums, and like I said, even just with clearing out their sinuses. Um, it's worth a
Cool.
try for sure.
And for
Yeah.
anyone who doesn't know, I believe you just take like a spoonful of oil, infused or not. You put it in your mouth, you kind of let it melt down and you swish it around for a while and then you spit it out. You don't swallow it after.
Right.
Yeah, just
No, you
to
want to swish it
clarify
around
there.
for a while. I would say at least 30 seconds to 2 minutes, as long as you can handle it. And then you're spitting it in the garbage so it doesn't clog up the drain.
Okay, very cool.
Yeah. On the legal market here in Canada, we have an infused toothpaste, and I love to recommend it for people who have inflammation or issues in their mouth because it's got a good amount of CBD and THC in it. We also have oral sprays, so that oil in a spray method to help hit that target directly. We see dental companies creating cannabinoid based blends and even patenting those blends to put into mouthwashes, to put into chewing gum, and even infused dental fillings. So, generally, we're seeing these dental products come out for pain relief, like from tooth pain, gum soreness, to help decrease bacteria. Like I said, the antimicrobial property, antiseptic agents, all things that we want to maintain good oral health with, anyways. And again, just giving you kind of a natural product to try instead of, the typical oral hygiene products that use some synthetics, for example.
And it really is the perfect product for inside your mouth, just exactly what you just described. I mean, often people have tooth pain, inflammation, and microbial issues. And these are things that cannabinoids are just absolutely amazing at. And, I think the toothpaste you're referring to, actually, do you have that near you? Can you hold it up just so people can see
Mhm.
what it looks like?
I sure
Um,
do.
yeah, and like that probably uses isolate products. So it says 125 milligrams of CBD and 6.25
Six.
milligrams of THC. And I'm guessing that's per serving. Is that per serving or
That's
total?
in the whole bottle.
Okay,
Yeah,
never mind. That's total. But
50
I'm
grams.
I'm guessing you could use like a full extract type product. It just might be, a little less minty fresh tasting and a little more, composty tasting, but some people don't mind that. There's definitely some organic toothpaste out there that I've tried and I'm like, "Oh my gosh, it feels like I'm brushing my teeth with clay." But I mean, if it works, it works.
Well, absolutely. And we know that the science is there for the entourage effect, right? To get the whole plant, get your terpenes in there, get your flavonoids in there, and you'll have even more of a therapeutic effect. So, totally a proponent of growing your own and putting it into your own products. products for sure.
Yeah, and speaking of doing it yourself, I love posting like recipes of topicals and tinctures and just saying like you can do this at home, here's the tools you need. Same thing with toothpaste. I bet if you have a toothpaste at home that you love, you could make a cannabis oil and add some into that toothpaste and then just use it that way. So if you either don't have access to a cannabis toothpaste where you are, you can just make one. Or if you can't afford it, a lot of these products are more expensive than our average toothpaste. And a lot of people are struggling out there. So if you do have like an oil, or even if you do have isolates at home, I buy isolates to make my products, and you could mix that into that toothpaste and have no difference in the taste, but maybe a difference in the efficacy that you're looking for.
Totally. Yeah. You might see improved color of the gums, less bleeding, less pain. And there's so many reasons to utilize cannabis for dentistry, which is what I try to teach about, not only within the mouth, but we see topical cannabinoids being used for people who have jaw pain. It can
Mm.
actually get down into that bone level. So now we're looking at, can we regenerate bone with something like a CPG toothpaste? Yes, the answer is that more science is needed, as with everything, but we're seeing bone regeneration and regeneration of oral tissues, including the dentin, which is part of the root of the tooth, the pulp, where the nerve of the tooth is inside. And that's amazing. Not only that, but then people coming into the dental office using CBD for anxiety and to decrease stress, which we know so much about. The dental office can be a very nervous, anxiety-ridden place. So some dentists in the States are already using CBD as an option for those nervous patients before they come in to have their treatment, which I think is just great that they're offering that as an option.
Yeah, it's great they're offering any option because it's like a lot of people who struggle with that type of anxiety. And just for the listener's sake, you shouldn't be using THC when you're going in for anesthesia, correct? Like that means the anesthesia, you might need a larger dose or something. Would you mind touching on that just so any listener who's going in for surgery or dental work, make sure that they are respecting that practice and making sure they're getting dosed correctly?
Absolutely. This is the other side of what I teach dental professionals. I want them to know about all these applications, but I also want them to know about implications so that we're safe as your provider and that you're having a safe experience as the client in the chair. So generally, your dental hygienist or dental professional should be asking you, do you consume cannabis? And you should feel open to say yes. And they should then have a non judgmental, professional, ideally educated conversation with you about any potential risks and just gauging your understanding, your level of education around that. Maybe this is an opportunity for you to talk to a healthcare provider and teach them something because you're so knowledgeable in your cannabis. But what a lot of people don't know is that there is this potential drug-drug interaction. Even though cannabis is generally safe and not a lot of drugs in dentistry have this interaction, when you are getting a needle, local anesthetic, it often has epinephrine. And with THC, we know that the heart rate can be raised. It can also affect your blood pressure. So if you didn't tell your dentist that you are currently under the influence of THC, you're going in for some freezing, they might find that it's not taking as well as it normally does because now both of these drugs are in your system fighting to be metabolized by the same liver enzymes. And the one is floating around because the THC is already busy getting metabolized. So we're trying to prevent a medical emergency because if I now have to give you another carpule of freezing, there's double the dose of epinephrine. And again, this potential for a medical emergency is what we call it. So what we're asking is either don't consume cannabis for about 12 to 24 hours before the appointment so you don't have THC in your system so that the freezing can work on its own, or at the very least let us know so that we can plan ahead for that potential interaction. And I've heard dentists say, I luckily they had spoken to me. I thought to ask them if they consumed cannabis, and you were right. That freezing didn't quite take, so I had to send them home. And then when they came back, it worked fine. So it is very possible with even just a short um, period of abstaining from THC that you can have a perfectly fine experience getting your filling and then go back to your normal habits.
Cool. Thank you so much for that. And it's just always sad to me that so many people can't be honest about their cannabis use to their medical professionals because, it really isn't safe for a lot of people in a lot of states that they live in. And unfortunately, in this situation, it's not safe for you to lie. So you definitely do need to tell the truth. And I hope that you can get a dentist that you trust enough to be honest with. There's a lot of great dentists out there, but yeah, it's the unfortunate truth about cannabis and the current legal landscape. It is scary out there for
For
sure.
sure.
Do you mind if we talk about other consumption methods like vaping? And this could,
Mhm.
obviously a focus on cannabis, but if there's tangential information about nicotine and tobacco vaping, that's relevant too. Whatever in that realm of oral health and vaping.
Yeah. In general, with vaping, we don't have long-term evidence. So we don't know the long-term effects of vaping in general. It could still cause dry mouth. So we're still looking at those potential dental effects causing more plaque. Um, that makes me want to just jump off to the side for a second to say that what we see with chronic inhalation, whether it's vaping or smoking, the studies are looking at what issues are coming up. So you might be more likely to have cavities if you chronically smoke or inhale um, combusted cannabinoids, which could be the same with vaporized cannabis extracts because they can cause dry mouth. So same thing, increased cavities, early onset perio. So if you're getting your bone levels checked, we're seeing that younger people are losing those tissues around their teeth from chronic inhalation of cannabis. And then just like you said, we might not be taking as good of care of our teeth if we're chronically smoking, is what the science is showing. So do please continue to brush twice a day and floss at least once a day and go in for dental checkups so that you can prevent those issues from happening.
Yeah, I know a lot
Personally,
of
oh,
like
sorry.
anecdotal stories just about people just, eating a bunch of sugary snacks and getting the munchies, sitting there, falling asleep on the couch and then not brushing the teeth. And like that combined of like eating the sugary food from the munchies and then not brushing your teeth is like a really bad combo, I feel like. And it's unfortunately a little notorious in the cannabis world of cannabis causing that sort of relaxation and munchy effect.
For sure. Um it's true. Yeah, you want to relax at the end of the night. You're not craving a healthy salad at that point. You're craving foods that are carcinogenic, or the bacteria in your mouth really likes to turn those sugars into disease causing
Is that what they're called? Karyogenic
compounds.
bacteria when they cause cavities?
Yes, exactly. Exactly. And carcinogenic foods, any carbohydrates can get turned into potential dangers in the mouth.
Interesting. So is there
Um,
data on like cannabinoids specifically being able to kill the karyogenic microbes in the mouth?
You've got it.
Cool.
Yeah. We did studies on cannabis infused toothpaste and cannabis infused rinses and compared them with common toothpaste brands and chlorhexidine, which is like a really strong prescribed dental mouthwash. And the cannabinoid infused products did an amazing job at killing those bad bacteria, almost on par with the dental products that we're familiar with. So absolutely, there may be a risk where you're having more of that bacteria, but we can then potentially also use cannabinoids to decrease that bacteria in the mouth that could lead to either decay or gum disease.
Wow. That's really cool. I'm glad those studies exist. I mean, that's just
For
such a
sure.
good case for using cannabis products and mouth
Yeah, they're
formulations.
coming for sure. We need a little bit more information about vaping, but generally we see, like I said, the dangers with heat in the mouth. They could change the tissues to cause infection, something like candidiasis, which is a thrush. We see stomatitis, which is like inflamed soft palate issues. I've certainly seen interesting cases with vaping in general. It might have been nicotine, like you said, but they get sores on the roof of their mouth, and then you're just chronically consuming. So you're not giving those tissues a chance to rest and breathe and heal. Staining can it's not always the case, but it can definitely happen from smoking and from vaping. And I would just say, take a look in your mouth. You know, if there's any changes, anything red, anything white, anything suspicious that doesn't go away in about 2 weeks, then I would make an appointment and see your dental professional, and again, be open and honest about your habits so that they can help you if it is potentially something that's going to become an issue down the road.
Yes, I think that's great advice. And would the advice from a dentist, if you were wanting to use cannabis medicinally, but not necessarily for oral conditions, would the advice be edibles? Is that what you typically recommend for consumption method? I mean, a lot of people can't feel edibles or just don't like the effects, but I'm just curious for an alternative to smoking and vaping, what you typically recommend.
Yeah, we would obviously get to the base of your why. So, what's your intention for this medical purpose? But often start with oils because they're a little bit easier to dose and potentially less adverse effect. If you accidentally had a strong edible, it's not gonna, the oil wouldn't last as long in the system as a strong edible might. So generally, yes, if you're new to cannabis, we're looking at a balanced oil to try and start that process of experimentation. But some people like to put the oil into their food, and some people like to make their own edibles. There's also strips that you can put if you're treating something in the mouth in this case. Um, Although that said, they sit under the tongue and they work systemically as well, so you're still getting that effect.
Hmm.
But I
Oh, the
have
strips sit under the tongue. They don't sit on
yeah,
top of the mouth like a Listerine. Wait, that one goes on your
no.
tongue, doesn't it? I don't know.
The Listerine would go on your tongue to help with your bad breath, but it's actually called a sublingual method for the oil and the strips. You want to place the strip under your tongue so that it's right next to that moist mucous membrane and getting again through to the blood-brain barrier a little bit easier there.
So
I
it's kind
had
of
a
like a
friend who had
hybrid. Sorry, keep going.
yeah, no, exactly. So you've got the effect in the mouth, but then it's getting into your body and you're having again that longer duration of effects for sure. Same with the oil. Starting out in the mouth, even a beverage, you're getting some immediate
Mm.
effect because it's going right through those tissues. But then as you swallow it, it's hitting the digestive tract. And as we know, it takes longer to kick in. So longer onset, longer duration. That's
Yeah,
why
and
the
I
oils are nice. Yeah,
I
you
feel
get
like the
that.
oils are like the most versatile. Typically, when I'm making other people medicine, I typically make them oils because, as you said, they are so versatile. Whether you want to put it under your tongue, whether you want to put it in a lotion and rub it on your skin as a
Mhm.
topical, whether you want to cook with it, like MCT oil, which is what I make my products with, that can be cooked with in any dish that you use an oil or a butter. So definitely the most versatile. And I do love that about oils. But some people just hate the taste and can't keep it under the tongue. But
Sure.
then I'm always like, medicine's not supposed to taste good. I mean, you wouldn't take an aspirin, tincture and say, man, this doesn't taste like watermelon. I'm so sad about that. So,
Very
you know,
true. But again, it's a fun time to be in the product creation world where we have new technology that helps good tasting products kick in quicker, that helps oils taste like mint chocolate.
yeah.
I've definitely seen some good tasting products. So we can work to find something that is going to help and might not be terrible to take. Um, yeah, I was just going to share a story about the strips of a friend who had to unfortunately have a number of teeth removed, and her
Oof.
method of consumption was smoking, and she couldn't take opioids for pain meds. So just imagine having your teeth removed and how painful that process of healing would be. It takes a little while. So she found some strips and placed them on the gums, a number of strips, and Amazingly, her dentist was very impressed with how quickly the healing process happened. Again, it's helping with decreasing that inflammation. It hit her pain receptors, so she's not suffering from pain. And then she can get back to normal life of eating and drinking, and went on to have some implant therapy, which again, I personally would love to see the science behind how that helped her bone regrow and now have these permanent teeth in her mouth again. So just an anecdotal story to say, like, these new products coming to market, we're just starting to learn about them. We need to continue to explore and share our stories if we do have success stories about how they're actually working, whether it's in the mouth or systemically throughout the body, because again, that overall health is related to your oral health. And let's target as much as we can with the cannabinoids, I would say.
Wow, yeah, for sure. And I love this component of like medical cannabis and really understanding, okay, where are the receptors in our body and how can we design a product to target that? Because no matter what system, no matter what organ, body part, whatever, like people are going to have a disease or an issue with that specific part of your body. So, why not create all of these diverse products that can stick and adhere and be really well formulated and produced for a specific condition. Like that's really how we make cannabis mainstream in this healthcare system is to design a scientifically backed product that specifically targets conditions there. I mean, it's really beautiful. And you mentioned opioids a couple times during this episode. And do you know what other receptors we have in our mouth? And if we have opioid receptors in our mouth or other receptors that are abundantly there?
We do. So if you think of the saliva gland,
Hmm.
we know that a lot of medications, the number one side effect is dry mouth. It's not just cannabis. So there are other receptors, specifically in the submandibular, underneath the jaw, saliva glands. What I found really interesting was that the level of anandamide plays a role there in how the saliva glands produce the saliva. So we did a study on rats looking at anandamide, but we can easily translate that study to THC. So now it helps us understand that when we consume THC, there's a change because of the CB1 receptor in that saliva gland, changing both the production and the consistency of the saliva. So same thing with other drugs. It can change the message being sent for those saliva glands for sure. Outside of that, when we think about different cells, there's different receptors for sure. I haven't done a lot of a deep dive outside of the cannabinoid receptors, but we have the TRPV1 receptors, we have the GPR55, and we have the CB1 and CB2 receptors in saliva glands, and like I said, in different parts of the mouth as well. Um, so that's what I can speak to. Yeah.
Cool. No, that I always I also only pay attention to like cannabis receptors often when I'm reading research, but sometimes I'll come across either papers or, somebody will reference something and it's like, dang, I should really think about like all these other plants and what receptors they bind to because we can take all of this obsession we have with cannabis and the ECS and like we can pair and have an even bigger entourage effect if we pair cannabis with these other medicinals and like really have that network of synergy happening in our body.
Yes, so many people say cannabis is the gateway to herbalism, and I would love to take that journey of like, okay, now I understand how this herb works, and now I can understand how other natural herbs work and why. And again, just fall in love with that science and be able to translate it to people. It's so exciting.
Oh, it's really beautiful. And just as we're kind of finishing up talking about consumption methods, is there any other consumption methods or products on the market that you think people should know about as far as the dentistry world?
I would keep an eye out for toothpaste. I know, especially in the States, there are different blends of toothpaste that are created and have been around for a while, like CBD Dent. It has CBG and CBD. So start incorporating that if you have any signs of inflammation in the mouth, and support these little niche products that are coming out. Like, have you ever tried infused dental gum for your pain? It might help you in the short term until you get the pain addressed. And then I would just say, yeah, keep an eye out for what's in your area. I haven't seen a lot, to be honest, when it comes to dental products, but I know they're coming. And I would especially be most excited to see dry mouth products like a mouth rinse or a spray that contain cannabinoids that are now flipping the science to say this actually doesn't cause dry mouth. It's made to help your dry mouth and help to moisturize your mouth.
Even, yeah, maybe something like THCV could work if it essentially
Mm,
kind of works opposite to THC.
right.
You would wonder if that would help with the old cotton mouth. Hmm.
Yeah. Somebody's going
Well,
to figure that out.
I was gonna say, it's pretty wide open right now if any of the listeners want to start formulating. I'm definitely gonna do a few
Yes,
experiments on myself as the old N of one experiments go. Um,
exactly.
so I have a question, just because, I obviously create content on the internet as well. And when you are creating content, you get a flood of messages from people with questions and things that you probably wouldn't even think of. Have you have you got any really interesting questions from people as you've been more open about being pro cannabis and this intersection of cannabis and dentistry? And just have you noticed a shift from when you essentially, came out of the green closet, as we call it, started to be open about being a cannabis advocate? Have you noticed how people just feel more comfortable talking about this around you? And it kind of like, how did that make you feel?
Oh my gosh, yes. When I do talks, it's amazing to just see the jaw drop of people who don't know what they didn't know. And I also love seeing the wide-eyed nodding of like, yes, normalizing the conversation about cannabis. She's literally standing in my classroom or she's hosting this professional webinar, and here we are being able to have this conversation about cannabis. So I do find a mix. Some people, they're not quite ready to hear that message, and that's okay. And later on, they'll come to me individually and say, I've had this experience with cannabis, or my loved one has a question about cannabis. Do you think it would help with this? Do you think it would help with that? And I always try to, just give education. There are resources out there. I'm definitely willing to help and work with you, and let's meet you where you're at. We also see people who are just, yeah, like, okay, this is great. We're now able to learn, and now I feel comfortable to share this information with my own patients. And the best reward has been people messaging me on LinkedIn saying, my dental hygienist went to your talk and we had a great conversation about cannabis today. So thank you for doing that. And that is my purpose in life. If you got that information from your dental hygienist who now felt more empowered to just start the conversation with you, listen to you, not be judgmental and help you with something related to your cannabis consumption and dentistry, then yeah, it's heartwarming, and I would do this for the rest of my life as if I could, for sure.
Oh, I think you can for sure. You're an amazing communicator and educator, and I appreciate everything that you're doing. And honestly, just talking about one of my very good friends, Kay or Kaylee, she's a dental hygienist, and I cannot wait to send this episode to her once it's
Yes.
released because I think she's just going to find it so interesting. And any other dentist
Nice.
people that I know, I'm definitely going to send it to because I think everyone will learn something in this episode. What are some commonly misunderstood things that you would encounter, whether it's just about dentistry in general, or it's about cannabis in general, or it's about this intersection that we're talking about between cannabis and oral health?
The number one thing people say to me is, what does cannabis have to do with dentistry? Like, why would you start this business? And then I start telling them, well, we have these products and we have applications for cannabinoids in our mouth and in our body, but we also have implications and knowledge that dental professionals need to know. So I would just say, of course, we need to know more about the endocannabinoid system in general. And then once we get that down, we might feel more comfortable about this relationship, that there is a relationship, both positive, where we can help with dental health, and some stuff that we have to be aware of, like some potential effects when you're in the dental chair, for example, and the edible hits and you've got to drive home. How are we going to address that as dental professionals? So, um, just more education will help with any potential misinformation that was out there or misunderstandings that people have based on the stigma that really still exists, unfortunately.
We talked about using cannabis before, like anesthesia, THC specifically. I should say we're talking about THC before anesthesia and the processing, but cannabis products in general. But for a regular cleaning or a regular dentist appointment, you could be a little bit high, right? Is that a problem?
Well, I wouldn't want like someone to try it for the first time and then go into the dental office because we know that that could make them a little more paranoid. We also know that um, it is a vasodilator. So you're going to have a little bit
Mm.
more bleeding. So that could throw off, the signs and symptoms of disease in your mouth. So again, if you're being honest and saying, I consume cannabis every day, I'm not under the influence so much so that I can't give you informed consent to provide the treatment that you need to provide. But I'm very much aware. I feel better this way and I can go out into the world and live my life under the influence of cannabis. Then yeah, we're not here to tell you to not take cannabis. We're not here to tell you to not take your medicinal cannabis at all. We just want to know more so how often you take it, if you take it for medical purposes, and when the last time you took it was, so that again, everybody in that room is safe.
No, that's a great answer. And I probably should have set it up a little better with saying like, for a regular consumer. And I think you tied that so well into like cannabis and driving too. Like obviously you had to get to the dentist and you got to get home. So make
Mhm.
sure, whatever dose that you're using is something that is your baseline and something that you don't feel intoxicated, you just feel medicated. And that is, I think a lot of your everyday consumers understand where that gap is, and you're
Right.
able to hone it in pretty well.
And you're able to have that conversation with your professional too, right? Like again, educate them about your ability to be aware of your consumption.
Yes, great point. So, just because you're an educator and I know you'll understand this, I kind of have a question from me, and that's clinical endocannabinoid deficiency. Are you familiar with that? Of the some people produce.
Yes.
Okay, awesome. Do you think that would have implications in your oral health as well if your ECS is so involved in the balance or the homeostasis inside your mouth? If you were producing lower levels of these endocannabinoids, would you potentially have chronic inflammation in your mouth or some other, microbial issue with excessive bacteria or not be able to fight that off? I don't know if that's like really a theory that falls within CED, but I'm just going to assume that we're going to see a lot more conditions being added to this theory of clinical
Mhm.
endocannabinoid deficiency. So we can, I'm kind of predicting that this oral health might be a component in the future.
Yeah, and in doing the research specifically around periodontal disease, they don't say clinical endocannabinoid deficiency, but they say um, that there's different levels of the receptors being activated. There's different levels of endocannabinoids when, again, in health versus in a diseased state. So, absolutely, with dysregulation of the endocannabinoid system, we're seeing that there's an increase in periodontal disease. And so, even people who go to the dentist regularly to get that periodontal disease taken care of, they might still be having a hard time and constantly fighting that disease if there isn't enough or aren't enough endocannabinoids, specifically anandamide. They're seeing decreased levels in these people who just can't come around to the other side of that disease, just can't heal properly. So absolutely, we know that that dysregulation of the ECS is related to periodontal disease, which is kind of the next step above gingivitis, where it's gone a little bit beyond the gums. And again, yeah, what can we do to target that? What can we do to prevent that? We're still figuring that out in terms of testing those levels.
Wow, that's really interesting. Yeah, I'm really excited to see that, theory expand in the future. And, I say theory with
Mhm.
big quotes because I think we have plenty of information that there is a subset of the population that does not produce enough of these endocannabinoids, and that leads to various chronic conditions, right? Fibromyalgia, IBS, chronic migraines, etc.
For sure.
Speaking of CED, speaking of oral health, like where do you think we need more research in cannabis, cannabinoids, and this intersection? Like if you could design a study that would help answer some of your questions, what would it be like?
It's a really good question. I want to just start with the broad need for more training in medical textbooks about the endocannabinoid system. I get to speak to third year medical students as a breast cancer patient about humanism in medicine, and I always ask them, how much education are you getting about the endocannabinoid system these days? And some people know what I'm talking about, and most don't. So, seeing this recent study that literally just came out about dental schools needing more education about cannabis in general, let's start by teaching these professionals that the endocannabinoid system exists because, like we just talked about for an hour, there's so many potential targets for disease once you understand that system and those receptors. So I mean, I'm so proud of where we've come as a general society with understanding that science and all the people like yourselves out there sharing the science. The public is starting to know about it. So we're advocating for healthcare providers to research it as well. But if it was already in their curriculum, then it would just uh, be more of the normal conversation, right? And
And
then we
like
could have more studies.
and like used as a first line treatment instead of a
Mhm.
last resort. Like that's
For
what kind of
sure.
drives me nuts about cannabis and modern medicine. And you know, my mother-in-law is a great example of this. She couldn't sleep. Like she literally could not sleep for like 6 days. And you look at her and you're like, oh my God, are you okay? Like she looked like she hasn't slept in 6 days. And she said, I really want to try cannabis for this. Like, can I get my medical card? And they made her try Ambien before using cannabis. Obviously, I gave her a bunch of cannabis, but like to get her medical card through her physician and for her physician to be on board, she was forced to try a pharmaceutical drug that has known terrible side effects, whereas cannabis like is so well tolerated in almost everyone at relatively high amounts. It just blows my mind. That changed my whole perspective on what's going on in our medical society right now.
I see it all the time. I consult and coach with patients to try to help them figure out how to make it work without spending too much time and money in it. And it is often at the end of the line where the doctor says, okay, we've tried everything else. Either the side effects of that drug were too much, or it didn't act the way it was supposed to, or we've tried so many that now I'm okay with you going to see Stacy to talk about cannabinoids. Like and then they have usually a really good success story. And what would their quality of life been like if they didn't have to go through that process? So I agree. It shouldn't be the last resort, but it unfortunately still is.
But education is the solution. Like when you find out that the ECS is involved in all of these other processes in our body and all these other systems which other drugs act on, and understanding like the role of the ECS is to bring balance to your body. And there's so many conditions that are just an imbalance of something. And, you know, that's where cannabis should come into play as just a first line treatment saying, okay, is it some sort of dysregulation in your ECS, especially with conditions that we don't know a lot about? Is it some sort of dysregulation in your ECS, or can using cannabis, you know, help figure this out? Yes, no. If no, then we move to a pharmaceutical drug. But, you know, first line is just insane to me
Mhm.
because it's been shown to be, you know, good for so many different conditions and so many different parts of our body.
Yeah, and we're still learning more about what it's been good for, right? Like we have so much evidence about chronic pain, so pain that's been around for 3 months or more than 100 days and it's affecting your quality of life. I thought that that was the only thing that cannabis was good for. But again, another recent study just at the end of last year was showing that CBD specifically is great for acute pain. And again,
Hmm.
how am I going to tie that into dentistry? Again, the toothaches, the post-operative dental surgeries. Now we can use it for acute pain as well. The science is finally catching up to what many of us already know. So again, such an exciting time and so much more to continue to read about.
Oh man. Well, we're towards the end of the episode. I can't thank you enough for coming on. I really enjoyed hearing your perspective, and I hope you're open to coming on in the future because I just want to keep learning from you. But is there anything else that you want to say on this topic? The floor is completely yours. And then, Also just make sure you shout out social media and where people can find you, where dental people can get more information from you and like implement what you have to teach into their practice, and the hygienists and the dentists, and just, spread the education.
Yeah. Going back to my roots as a dental hygienist, I just want to say keep flossing, keep
Yeah.
learning about cannabis, and keep sharing your experiences. Don't be afraid to share those success stories to help normalize the conversation. I know it's difficult in areas where you're not supposed to be consuming cannabis, but that is going to change. So if you can get ahead of the game now, just don't be afraid to share and learn and lean on those facts. You can reach me on Instagram at CannaDent.ca. I usually share there all of my cannabis dental related talks, courses, events, conferences, webinars, all of that. I'm on LinkedIn as CannaDent, and my website is CannaDent.ca. And again, I just hope that dental professionals find me and that you can learn something new or a new way of explaining to your clients just again, how to continue that conversation about cannabis, or maybe a new way of listening to your clients about their cannabis experiences so that you can take that into your community or into your family, because more and more people are coming to cannabis. And you know what? It's not just younger people either. Once you start asking, do you consume cannabis? You'll see people of all ages get really excited about saying yes. It used to be I heard students asking clients, do you consume cannabis? And they would say, what's cannabis? Canada, 5 years of legalization, we know what cannabis is. And now we can continue the conversation about why you consume it, where you get it, how you consume it, how it affects you, and what benefits you're getting from it. So let's continue that conversation for sure.
Awesome. Well, keep killing it, and thank you again for being on. I think everyone's going to really like this episode.
I hope so. Thank you so much, Riley. It was really a pleasure.